A woman in her early 30s had been living an active, healthy life. She had no chronic illnesses, and, apart from a minor kidney stone removed years ago, she had been completely fine. She prided herself on her sustainable lifestyle, including her choice of menstrual products. For the heaviest days of her period, she used a menstrual cup, a small, reusable silicone cup she emptied every few hours. It was convenient, eco-friendly, and it never caused her any trouble, until it did. For 6 months, she began noticing a dull, intermittent pain in her right flank and lower abdomen. It wasn't constant. Sometimes it came a few times a week and lasted only about an hour. Occasionally, she noticed blood in her urine. It wasn't linked to her period. She didn't have fever, nausea, or any other alarming symptoms. But it was persistent enough to push her to visit a clinic. Doctors started with the basics. Her urine tests showed blood, but no infection. A cystoscopy, checking the inside of her bladder, showed nothing unusual. The pain was still unexplained. There were no stones, no tumors, no scarring, nothing that typically causes this kind of intermittent discomfort. Perplexed, the doctors ordered a CT scan, hoping it would provide answers, and that's when they found it. Her right kidney and ureter were swollen. The medical term is ureterohydronephrosis, essentially. Urine couldn't drain properly from her kidney to her bladder. Her kidney function was at risk, and yet there were no stones or structural abnormalities. Then the scan revealed the culprit, her menstrual cup. The cup, perfectly normal in every other sense, was pressing against the right side of her vagina, right where the ureter, the tube that drains urine from the kidney to the bladder, empties into the bladder. In other words, this small, simple device was mechanically blocking her urinary tract. The solution was surprisingly straightforward. The doctors asked her to stop using the menstrual cup and return in a month for follow-up tests. She did, and the results were dramatic. The swelling in her kidney and ureter disappeared completely. Her pain vanished. Kidney function returned to normal. Just removing the cup resolved months of unexplained discomfort. Months later, she cautiously tried using the cup again, but only for short periods. The fear of recurrence was too strong to resume regular use. She remained symptom-free, but the experience left a lasting impression. Menstrual cups are becoming increasingly popular worldwide. They are eco-friendly, long-lasting, and generally safe. But this case illustrates that even safe, sustainable products can have hidden risks. Complications are rare, but they do exist. Reported issues include pain, vaginal injuries, dislodgement of intrauterine devices, infections, and very rarely, toxic shock syndrome. And as in this case, a menstrual cup can physically block the ureter if inserted incorrectly, leading to serious kidney issues. For most people, menstrual cups are safe when used correctly. The key is proper insertion, choosing the right size and shape, and being aware of unusual symptoms. Pain in the flank, abdominal discomfort, or blood in the urine should never be ignored. The case also highlights a broader issue: the proximity of female anatomy. The ureters pass very close to the vaginal walls where the menstrual cup sits. It's a rare but real risk that a mispositioned cup can exert pressure on the ureter, causing obstruction. This isn't widely known among users, and many clinicians may not immediately consider it in their diagnosis. What makes this case particularly striking is how reversible the problem was. Once the cup was removed, her kidney swelling resolved completely. There was no permanent damage, no surgery, no complex intervention, just the removal of the obstructing device. This raises an important point about awareness. Menstrual cups can be used safely for years without any issues. But users need to understand their anatomy, be trained in proper insertion, and be vigilant for unusual symptoms. Something as simple as intermittent pain or blood in the urine during or outside menstruation can signal a problem. In this case, she had a copper IUD for contraception. That didn't contribute to the problem, but it could have complicated the situation if doctors weren't careful. Menstrual cups can sometimes dislodge intrauterine devices, but here, the IUD remained correctly in place. The issue was purely mechanical, the cup pressing on the ureter. The medical literature shows that this is an extremely rare complication. Only a handful of similar cases have been reported. Most patients present with flank or abdominal pain, often with hematuria. CT scans reveal ureterohydronephrosis, and removing the cup leads to complete regression of symptoms. In some cases, women switch to a smaller cup size or adjust insertion technique and can continue using the product safely. What stands out in this case is the delayed presentation. She had intermittent pain for 6 months before seeking help. During that time, she had no fever, no infection, just intermittent discomfort and occasional blood in the urine. It shows how subtle symptoms can mask a potentially serious issue. Her initial tests, urinalysis, and cystoscopy were normal aside from the blood. These are standard first-line investigations for urinary symptoms, but they don't reveal mechanical obstruction from outside the urinary tract. It was only when a CT scan was performed that the true cause was revealed. This case underscores the importance of detailed diagnostic imaging when symptoms are unexplained. CT urography not only identified the swelling in her kidney and ureter, but also revealed the precise cause, the menstrual cup's position. It's a reminder that even devices considered completely safe can interact unexpectedly with human anatomy. After the cup was removed, follow-up imaging was performed to confirm resolution. Ultrasound showed the swelling in the ureter, and kidney had completely resolved. Renography confirmed normal kidney function and drainage. Her symptoms disappeared entirely. This complete recovery is reassuring and shows that prompt recognition and intervention can prevent permanent damage. Even after this experience, she did attempt to use a menstrual cup again, but only briefly and cautiously. This demonstrates another aspect of patient experience: psychological impact. The knowledge that a simple, everyday product could have caused kidney obstruction created a lasting concern. While she remained symptom-free, the fear of recurrence prevented her from returning to regular use. The broader takeaway is clear: menstrual cups are generally safe and effective, but education is critical. Users must be aware of proper insertion techniques, the correct size, and potential warning signs. Health professionals should also consider menstrual cup-related complications in women presenting with flank pain, hematuria, or urinary obstruction. It's a rare complication, but one that can be completely reversed if identified in time. Simple mechanical compression of the ureter by a mispositioned cup can lead to ureterohydronephrosis, a condition that, if left untreated, can cause permanent kidney damage. Awareness and vigilance are key. Menstrual cups offer many benefits. They are eco-friendly, cost-effective over time, and convenient. For many women, they are a sustainable alternative to tampons or pads. But as this case shows, no product is without risk. Even devices with long-standing safety profiles can interact with anatomy in unexpected ways. It also highlights a gap in general knowledge. Many users have never been informed about potential complications. Menstrual cups can be purchased and used without guidance, yet subtle complications can emerge that require medical attention. Clear, accessible education materials could help prevent issues like this. Clinicians should include menstrual cup-related obstruction in their differential diagnoses when evaluating women with unexplained flank pain or hematuria. While rare, this complication is easily reversible once recognized. It's a reminder that even sustainable, everyday choices can have hidden medical implications. In this case, the patient had a previous ureteral stone removal years earlier. This could have been another potential cause of obstruction, but follow-up imaging ruled it out. The mechanical compression from the menstrual cup was the definitive cause. This case also emphasizes the importance of patient-centered care. Doctors carefully explained the situation, the likely cause, and the proposed solution. By stopping use of the menstrual cup and returning for follow-up imaging, the patient experienced complete resolution without invasive procedures. Communication, reassurance, and careful follow-up were essential. In conclusion, menstrual cups are safe and effective for most women. They are part of a growing trend towards sustainable menstrual products. But like any medical device, rare complications exist. Ureterohydronephrosis caused by mechanical compression is extremely uncommon but entirely preventable. Awareness, proper insertion, choosing the correct size, and vigilance for unusual symptoms are crucial. If you experience flank pain, abdominal discomfort, or blood in your urine, do not ignore it. Early consultation and appropriate imaging can identify rare complications before they lead to lasting harm. In this woman's case, months of unexplained pain were resolved simply by removing the menstrual cup. Her experience reminds us that sustainable solutions, no matter how safe, can have unforeseen effects. Education for both users and clinicians is key. Choosing the right cup, learning proper insertion, and monitoring for warning signs ensures safe, effective use. Awareness saves health even when the product is as simple and eco-friendly as a menstrual cup. The story ends with relief. Her kidneys recovered fully, her pain disappeared, and her life returned to normal. She remains cautious but informed, aware that even small, everyday choices can have unexpected consequences. This case is a rare reminder that safety, awareness, and knowledge go hand in hand, no matter how routine a product seems. Months later, she occasionally uses the cup for a few hours, carefully monitoring her body. She hasn't experienced a recurrence, and she remains healthy. The fear is there, but so is the knowledge a rare complication turned into a powerful lesson. Menstrual cups will continue to be a popular choice worldwide. This story should not scare users, but should empower them. Understand your body, follow best practices, and pay attention to unusual symptoms. In doing so, menstrual cups can be safe, sustainable, and life-enhancing without ever repeating this rare complication. What do you think about menstrual cups after hearing this story? Have you or someone you know ever experienced unusual pain while using one? Share your thoughts in the comments below. And if you found this story eye-opening, hit that subscribe button and turn on notifications so you never miss a fascinating health story like this one.